All right, we can start our discussion. So, I think we will start from aphorism number 100 today. We are at the century of our discussion. Aphorism number 100. 100, 101 and 102 regarding the case taking and prescription means finding the genus epidemicus of the epidemic diseases. Okay, epidemic diseases we have discussed already that maybe an individual kind which is occurring at once in whole history. Only once this kind of fever was seen, and then that has been vanished. Am I audible?
So,
Okay. In the whole history, this epidemic was never seen before. Clear? So this was epidemic by some individual causes, by some other, and there are epidemics which are from acute miasms. Okay, these epidemics which are from acute miasms are going on repeating itself, and this again can be differentiated into two: those who are recurring in the individual life, recurring type, that typhoid, plague can occur several times to a person, and those epidemics which are only occurring once, non-recurring in individual life, and both are due to certain type of acute miasms. Okay, so epidemic diseases in general are due to some epidemic, some acute miasms. So 100 and having a fixed character. Okay, so we have discussed during our discussion of acute miasms that this can be medicine can be fixed for them. So 100, 101, 102 is dealing with the case taking of acute diseases, epidemic diseases, and finding out a remedy for whole of the case prevailing at that time. Okay, suppose a chicken pox epidemic have broken out. In spite of knowing all those symptoms of chickenpox, you are taking the chickenpox which is prevailing at the point of time, at that point of time, and finding the remedy for that. This may be possible that chickenpox of this year requiring pulsatilla, and chickenpox of previous year was requiring some other medicine. This may be possible, but possibilities are less. Okay, because of acute miasms, fixed character and fixed symptoms. Okay, but a fever of certain kind which have never been seen before is prevailing in the area, and this is an epidemic disease, and this kind of fever you are not going to see in next year. This is also epidemic disease, and you are trying to find a medicine for this prevailing kind of fever. Okay, so how to find a medicine, genus epidemicus, for this peculiar type of epidemic which is running around. Okay, so this aphorism number 100, 101 and 102 is dealing with that. Remember the earlier cases of pandemic, this pandemic we are going through, how homeopaths all over the world were able to point out arsenic as a remedy for that. Okay, this is not a random, this was not a random case. Homeopath around the world studied the symptoms which were coming and pointed out that this may be helped out with arsenic. Later on it was found that this epidemic was having a psychotic basis. Okay, and arsenic, we know, one of the antipsychotic medicine. Okay, if you have your J.H. Allen with you, okay, let me search my J.H. Allen first, then I will tell you. Give me a minute. I will I will find out my JHLN. Give me a minute. And try to have your JHLN MISM with you. I will back in a second. Okay, I got mine. I hope you you are having yours. Okay, okay. Give me a second. I will find it out. Okay.
No, volume I am asking, sir. Part 1 or part 2?
Oh, you are. Oh, mine is both are together. The volume you should have. I think it's second volume. Second volume.
I don't have.
Second volume. I will tell you the page number. You know that in 1920s, influenza was the epidemic. Spanish flu was the epidemic at that time. Okay, so page number 30 of this second volume. In my case, I don't know which where yours lies. In my book, it is page number 30. Page number 30. The psychosis. From the psychosis, 1, 2, 3, 4. I cannot count the paragraph here. I am reading it. I am reading it. This paragraph. A case comes to my mind of a young man who 8 months previous to his death was strong and healthy. No finer physics or better specimen of health could be imagined, but he had a faint history of tuberculosis in the family. He was suddenly taken ill with the appendicitis. This one. Got that?
No, sir.
Around 10.
Actually, sir,
Okay. Now,
actually, sir, I
around
don't have.
10 lines later to that, whole families of tubercular patients are swept out of existence by our epidemic of La Gripe. La Gripe is nothing but influenza, Spanish flu of that time. Okay. Before also, there were, this JHN have been written before 1920s pandemic. So there was another pandemic before also, when this book was written, during the time of J.H. Allen. Whole family of tubercular patients are swept out of existence by our epidemic of La Grippe and other acute expressions of psychosis. So this COVID was also an acute expression of psychosis. Okay, that is why most of the time you are finding most of the remedy which you are indicating were of psychotic basis. Okay, let me show the page. Many of you may not have it. So this one, it was such an astonishing when I read this. Many of us overlook the fact that almost very case of La Grippe requires an antipsychotic remedy such as Rastrox gelsemium in first stage of its invasion. The fever, coryza, acute rheumatic invasion are truly the phenomena of psychotic element of a contagious nature which is life force is vigorously endeavoring to throw off. Okay. La Grippe, from its start to its finish, we will see that it has a specific positive action which allies it to psychosis. It has fever, cough, pain, catarrhal invasion of the nose, bronchi, lungs, eyes, or other mucous membrane, as does psychosis. Okay, so this is J.H. Allen telling Rastrox and gelsemium. About that, and Rastrox and gelsemium including Dalgamara, we know that is one of the antipsychotic medicines. Now, tell me by your experience what medicine you have seen, what medicines you have seen working in this COVID pandemic. You have seen arsenic, you have seen gelsemium was working, arsenic was working, pulsatilla was working, especially to the loss of sensation. Okay, we have read in miasm, Robert's miasm, that this loss of sensation was psychotic. Okay, we have read when it is psychotic, when it is syphilitic. Okay, you have read that too. In Robert's anosmia is one of the symptoms for psychosis, and when it is destructing the nasal mucosa, due to destruction of nasal mucosa, it is syphilitic. Okay, and it's sometimes that atrophic rhinitis because of the nasal drop, atrophy of the nasal mucosa. This is created form, artificial form of disease. So from where to where we have departed, we were telling that this pandemic we are going through is an acute expression of psychosis. That is why people were able to pinpoint the arsenic. We know that now open this Borix in the last page where thuja and arsenic is there. You will see the arsenic and thuja, last table, you will see that arsenic and thuja have a very acute relation with each other. Okay, they follow each other. Even in acute cases, you will be needing arsenic. For people requiring thuja for the chronic cases, they will require arsenic. So arsenic is also antipsychotic remedies. There were people using Dalgamara, gelsemium, pulsatilla. All these are acute antipsychotic medicines. Okay, so I was telling that how people around the world were able to tell that this is the remedy may be used in this current pandemic because of they have studied the symptoms. Okay, they have studied. It was very unfortunate that initially we were not given the chance to treat this pandemic, and this was, I have told, this was the stimulus to begin for this class, that I have told you in the very initial classes that there are less and less clinicians nowadays. More and more researchers are there, but less and less people who are actually practicing homeopathy in among the common folks. That is why this was the condition that we have not been allowed to treat these COVID cases. And later on, jo to hua. Later on, they are treating as happily as they are. Whatever man is coming and telling that yes, this can cure, and they are accepting this. And initially, we were not having given any chance to treat this. It was very unfortunate. This could have been a changed scenario. Why it has happened? Because of our not understanding of this philosophy, fundamental philosophy. We were thinking that where from this is something else. Humankind have not suffered this disease before, or this is we don't actually able to recognize where from this is cropping up. Okay, there are lots of things I wanted to tell, but because of this our limited time period, I cannot discuss with you. I wanted to discuss with you why this virus is attacking human being again and again. Okay, there is a concept of Vitholcus that when you are abusing antibiotics, bacteria are declining, virus will increase. Okay, bacteria is a superlative form of life than virus, but you are killing bacteria, then what is coming? Fungus. You are killing fungus, what will come? Virus. You will kill virus, what will call? Proteome. Another means lesser than virus, it will start affecting you. Okay, so that is the different topic, totally different topic. I wanted to tell you that if we were actually accustomed with our knowledge of Organon, because there are in the histories people were able to control cholera, epidemic of diphtheria, epidemic of mumps, epidemic of whooping cough with homeopathic medicine very easily. Okay, in the history, these are the recorded cases when Hahnemann himself, without seeing a single case of cholera, was able to pinpoint the medicine that yes, chyprum You may use Kipram, you may use camphor, or you may use veratrum album, pinpointing the medicine. Why it was possible? Because of studies of this symptoms. That is what have been discussed in aphorism number 100, 101 and 102. Now, please read aphorism number 100. Rashmi, can you read for us?
Yes, sir. But I think
Okay.
I'm having
Read a bit
difficulties.
loudly. Okay.
In investigating the totality of the symptoms of epidemic and sporadic diseases, it is quite immaterial whether or not something similar has ever appeared in the world before under the same or any other name. The novelty or
Okay. This is
peculiarity
the
of
first
a
sentence. This is the first sentence. You should be unprejudiced of that, whether it is chickenpox or measles, and that has appeared. Though it is a fixed miasm, though it is coming from an acute miasm having fixed symptoms, still you are going to investigate it properly.
The novelty or peculiarity of a disease of that kind makes no difference either in the mode of examining or of treating it, as the physician must anyway regard the pure picture of every prevailing disease as it were something new and unknown, and investigate it thoroughly for itself. If he desire to
Underline
practice
this.
medicine,
Underline this.
if he
Next.
desire to practice If we desire to practice medicine in a real and radical manner, never substituting conjecture for actual observation, never taking for granted that the case of disease before him is already wholly or partially known, but always carefully examining it in all its phases. And this mode of procedure is all the more requisite in such cases, as a careful examination will show that every prevailing disease is in many respects a phenomenon of a unique character, differing vastly
Underline
from
this.
all
Underline this.
differing
Next.
vastly from all previous epidemics to which certain names have been falsely applied, with the exception of those epidemics resulting from a contagious principle that always remains the same, such as smallpox, measles, and etc.
This clear? Exception is clear. That is what I have told you initially. That is, this is exception coming from acute miasm having fixed character. So medicine can be fixed and specific for those. Okay. But there are epidemics which are always of a new character. There are certain fevers which we are telling that it is Gaul fever, but it is different. The peculiar kind of Calcutta fever roaming again and again sometime. But this Calcutta fever was different from the previous year, and that Calcutta fever which is coming 10 years after will be different from now, which was going on. Okay, so this is a different kind of epidemic, and those epidemic coming from the acute miasms having a fixed character with exception. Next, 101. So this 100, what 100 is telling? 100 is telling about investigating each cases afresh without any prejudice in the mind that it has been known before. Okay, this is prologue for the investigation of acute miasm, investigation of epidemic diseases. Next, 101.
It may easily happen that in the first case of an epidemic disease that presents itself to the physician's notice, he does not at once obtain a knowledge of its complete picture, as it is only by a close observation of several cases of every such collective disease that he can become conversant with the totality of its signs and symptoms.
Underline close observation of several cases. Close observation of several cases. Such collective disease. What is collective disease here? The disease which is affecting many human beings at a time, at a given point of time. A disease affecting many human beings is being called here as collective disease or that epidemic disease. Okay. Now,
The
next.
carefully observing physician can, by the examination of even the first and second patients, often arrive so nearly at a knowledge of the true state as to have in his mind a characteristic portrait of it, and even to succeed in finding a suitable homeopathically adopted remedy for it.
Okay, but a careful observing physician may need not to see 10 or 100 cases. It is enough to see 1 or 2 cases for him to arrive at genus epidemicus. Next, 102. So underline those, close observation of several cases. Next, 102.
In the course of writing down the symptoms of several cases of this kind, the sketch of the disease picture becomes ever more and more complete, not more spun out and verbose, but more significant, more characteristic, and including more of the peculiarities of the collective disease. On the one hand, the general symptoms, example loss of appetite, sleeplessness, and etc., become precisely defined as to their peculiarities, and on the other, the more marked and special symptoms which are peculiar to but few diseases and of rare occurrence, at least in the same combination, become prominent and constitute what is characteristic of this malady.
Underline this. Underline this. What I'm telling. Peculiarities of this collective disease. Peculiarities of this collective disease. Okay. Then general symptoms. Underline general symptoms become more precisely defined as to their peculiarities. On the other, more marked and special symptoms. More marked and special symptoms become prominent and constitute what is the characteristics of this malady. Okay, suppose you have a malady to deal with having this 10 symptoms with it. Okay, okay, this 10 symptom. So this whole 10 symptom you are not going to see in a patient A. Okay, you will be seeing, say, only 1, 4, 3, 7 symptom in patient A. You are going to see patient B, and rest of the symptom you see in here 6 and 5. Symptom number 6 and 5. Okay, you have seen A, B, and C. So 9 and 10 you are seeing here. Okay, after seeing all 3 patients, you are able to make a picture of 10 symptom, picture of disease only after. Or what has happened, that if you are seeing more patient, if suppose you are seeing patient number D, you will see that this 9 and 10 symptoms are present here, but it is more defined. Okay, so picture of disease is becoming more clear. A, B, C, D. Okay, after examining several cases, you are not getting any new symptoms first. You are not getting any more peculiarities about those symptoms. Okay, then you have completed your picture of this malady. Okay, the malady was having only, sorry, the malady was having only this symptom, this much symptom. Okay, only this much symptom, but all these symptoms are you are not going to get in one case. All these symptoms you are not going to get in one case. For that, and all these symptoms you will not going to get whole picture of each symptom, whole peculiarities of each symptom in one case. You are examining several cases, and these symptoms are elaborated further in those cases. Okay, so you have marked more marked and special symptoms which are peculiar but few disease become prominent and constitute the characteristics of this malady. Here the sentence number 1 end. Okay, you get a footnote here. Read that footnote.
The physician who has already in the first cases been able to choose a remedy approximating to the homeopathic specific will from the subsequent cases he be enabled either to verify the suitableness of the medicine chosen or to discover a the most appropriate homeopathic remedy.
Okay, underline this homeopathic specific. Okay, This is where Hahnemann is talking about genus epidemicus. This will be asked in your examination, theory examination, case taking of epidemic diseases. Now read the next part of this aphorism.
All those affected with the disease prevailing at a given time have certainly contracted it from one and the same source and hence are suffering from the same disease. But the
Underline
whole
this,
extent of
at given point of time, underline at given point of time, contracted it from one same source and hence suffering from same disease. Here is the exception to individualization. We have discussed this point in detail while we were discussing specifics in homeopathy. Okay, so you can refer to that lecture later on. So this is an exception to what? Individualization, suffering from the same disease. Okay, because they have contracted it from one and the same source. Clear? Underline one, same source, suffering from same disease. Underline this. Next, at given point of time, don't forget this. At given point of time. Okay, maybe fever in the September, which was rovering in Calcutta, was a different type of malaria, while the fever in December, which was rovering in Calcutta, was a different kind of malaria. Okay, at given point of time. In this point of time, when this epidemic is running, is the collective disease of similar nature, of same disease. No individualization is required here. Next.
But the whole extent of such an epidemic disease and the totality of its symptoms, the knowledge whereof, which is essential for enabling us to choose the most suitable homeopathic remedy for this array of symptoms, is obtained by a complete survey of the morbid picture. Cannot
Okay,
be
this
learned
can
from
be
one.
a totality definition of totality of symptom. See, totality of symptom, after that a bracket, this can be a definition for totality of symptom. What is the totality of symptom? The totality of the symptom, the knowledge whereof, which is essential for enabling us to choose the most suitable homeopathic remedy from this array of symptoms. So this is separating the portrait of disease and totality of disease. No, Anirban was asking a question when we were dealing with totality and portrait of disease. What is the difference between those? You can tell this may be a difference between the portrait of disease and totality of symptom. Okay, from this array of symptom, what you are choosing for your medicine is enabling you for the totality of symptom, is giving you the totality of symptom. Okay, this might be a controversial topic in your exam, so don't use this for your examination purpose. In examination purpose, you can say that yes, portrait of disease is this means portrait, collective whole collection of the symptom, and totality, like we have discussed the Gandhiji, the portrait of Gandhiji, and chashma, lathi, and dhoti of Gandhiji. Dhoti, chashma, lathi of Gandhiji is totality of symptom. Okay, and a portrait of Gandhiji is portrait of disease. Okay, though you can prescribe on portrait of disease also and this totality of disease also, totality of symptom also. Next.
Cannot be learned from one single patient, but is only to be perfectly deduced,
So
abstracted,
now,
and
yes,
ascertained.
totality of symptom cannot be learned from one single patient. Okay, that was in the bracket. Next.
But is only to be perfectly deduced, abstracted, and ascertained from the suffering of several patients of different constitutions.
Okay, clear what this aphorism is telling about? Is it clear? Because after this, the medicine for chronic diseases will start. Okay, this is actually a side topic which have been incorporated here. Okay, this is actually a side topic for epidemic. This is epidemic ended here, 103. Now this is a side topic for chronic disease which is incorporated here. Okay, just go on reading.
In the same manner as has here been taught relative to the epidemic diseases, which are generally of an acute character, the miasmatic chronic maladies, which, as has as I have shown, always remain the same in their essential nature, especially the sura,
Underline this.
must be
Underline this. Always remain same in their essential nature. So you might, I have told you that one of our teacher, when we asked that why you are using only 3 and 13 and 14 medicines for whole of the cases you are seeing, he told us how many diseases we have to cure. Only 3, with a smile on his face, and it just a huge bulb was open before us that yes, we have only 3 diseases to treat. So how many medicines we need? So that was a different thing. That was actually the same thing he was saying. Next.
must be investigated as to the whole sphere of their symptoms in a much more minute manner than has ever been done before. For in them also one patient only exhibits a portion of their symptoms, a second, a third, and so on. Present some other symptoms which also are but a dissevered, as it were, portion of the totality of the symptoms which constitute the entire extent of this malady. So that the
Underline
whole
this.
array
Underline this. Constitute the entire extent of this malady. How sulfur becomes the king of Sora? Because of its totality of symptom. Hahnemann actually investigated the whole array of symptoms of Sora. Like, but this Sora is expanded in time. Epidemic was only at a given point of time, but this chronic maladies was expanded in time and generation. So Hahnemann have studied all the cases, all the symptoms of Sora, and found out that these group of medicines are helpful in treating these cases. Okay, by case checking of those afflicted with Sora, he noted down all the symptoms. You noted while our discussion on chronic diseases that there is no primary or there is no secondary symptoms or latent symptom of syphilis and psychosis given by Hahnemann. It was later on given by later stalwarts like J.H. Allen, okay, and others, and Roberts. Where these have come from? These actually have come from the provings of syphilinum and medolinum, plus these have latent symptoms have come from these, and plus from other clinical observation like Hahnemann have did, like we have referred to that facial cancer. Hahnemann is saying this is combination of Sora and syphilis. Okay, so only Sora Hahnemann have discussed. Symptoms collected by Hahnemann have recorded in chronic diseases are of only Sora, but cure have been told for psychosis and syphilis also. Later stalwarts recorded symptoms like we have read in Roberts' chronic diseases, recorded the symptoms of syphilis and psychosis also, like Hahnemann did for Sora. Okay, now next.
so that the whole array of the symptoms belonging to such a miasmatic chronic disease and especially Sora can be ascertained from the observation of very patients affected with such a chronic disease. And without a complete survey and collective picture of these symptoms, the medicines capable of curing the whole malady homeopathically, to wit the antisorics, cannot be discovered. And these medicines are at the same time the true remedies of the several patients suffering from such chronic affections.
Okay, true remedies for the several patients suffering from such chronic affections, antisorics. Okay, so this should come actually here, or these should come there. Aphorism number 204, aphorism number 204, 205, 206, 7, 8, okay, and 9 all together, from 242, 204 to 209. These either should come here or this aphorism should come go there. Okay, this is an isolated aphorism. We have told that this organon is consisting of aphorisms in group. It consists of aphorism in groups, but this is an isolated aphorism. मीन्स यू कैन से बिछड़ गया, अपने ग्रुप से बिछड़ गया इधर, या तो इसको यहाँ होना चाहिए था 204 के आसपास में, या 204 वाला अफोरिज्म पूरा ग्रुप यहाँ पे आना चाहिए था. सो वी विल रीड इट विथ दोज ग्रुप. So we will go to 204. We will go to because there is some relation with the topic Hahnemann is discussing. Okay, this epidemic case taking of epidemic Hahnemann is discussing, and there is some relation with that. So discuss the case taking of chronic diseases, and there Hahnemann was discussing about the external suppression of the external manifestation, and there was some relation with that. So Hahnemann discussed some portion there. Okay, so you will see in content. In content, go to content 206. Content 206. Preliminary investigation of the miasm. What is investigation? This is case checking. 207. Inquiry into the treatment of previously employed. What is this? Treatment previously employed. What is this? This is case taking. The other preliminary inquiries necessary for apprehension. What is this? This is case checking. Case checking of what? Case checking of chronic diseases. Okay? Clear? Now we will go to 204. Start from 204.
If we deduct all chronic affections, ailments, and diseases that depend on a persistent unhealthy mode of living, aphorism 77, as also those innumerable medicinal maladies, v. aphorism 74, caused by the irrational, persistent, harassing, and pernicious treatment of the diseases, often only of trivial character by physicians of the old school, all the remainder.
All the remainder. Wait here.
Of
now tell me what Hahnemann have missed here. Have excluded two things, but forgot to exclude another thing which he is excluding always.
Surgery.
Surgical diseases. Very good. Next. Surgical diseases. Always excluding surgical diseases. But here he forgot to exclude. Next.
Most the remainder of chronic diseases in the 6th edition, without exception, result from the development of
all the remainder, see the language. And this has been so meticulous, Hahnemann was in his work, that he thought there may be some other chronic diseases, other source of chronic diseases. So he told it, replaced it, all the remainder to most the remainder. Okay. Next.
Without exception, result from the development of these three chronic miasms: internal syphilis, internal psychosis, but chiefly and in infinitely greater proportion internal sora, each of which was already in possession of the whole organism, and had penetrated in it in all directions before the appearance of the primary vicarious local symptom of each of them. In the case of sora, the scabious.
We have discussed it during the development when we have discussed the development of chronic disease. Moment of infection, moment of penetration of the whole organism, and then bursting out as primary manifestation. So next.
In the case of sora, the scabious eruption; in syphilis, the chancre or the bubo; and in psychosis, the condylomata, that prevented their outburst. And these chronic miasmatic diseases, if deprived of their local symptoms, are inevitably destined by mighty nature sooner or later to become developed and to burst forth, and thereby propagate all the nameless misery, the incredible number of chronic diseases which has plagued mankind.
205. Leave it. Come to 205. Same thing have been discussed. We have discussed this already. So 205. Case taking will start from 206. 205.
The homeopathic physician never treats one of these primary symptoms of chronic miasms, nor yet one of their secondary affections result from their further development by local remedies, neither by those external agents that act dynamically, nor yet by those that act mechanically, but he cures in cases where the one or the other appears only the great miasm on which they depend, whereupon its primary as also its secondary symptoms disappear spontaneously. But as this was not the mode pursued by the old school practitioners who preceded him in
this is actually the case always. We are getting to treat these cases only after they have treated. Okay, who preceded him in the treatment? Patient will go to them first. Next.
The homeopathic physician generally, alas, finds that the primary symptoms have already been destroyed by them by means of external remedies, and that he has now to do more with the secondary ones, that is, the affections resulting from the breaking forth and development of these inherent miasms. But especially with the chronic diseases evolved from internal sora, the internal treatment of which, as far as a single physician can elucidate it by many years of reflection, observation, and experience, I have endeavored to point out in my work on chronic diseases, to which I must refer the reader.
If you want to learn more, go and read the chronic diseases, what Hahnemann is saying. Now go to footnote, last page. Footnote. I cannot therefore advise, for instance, local extirpation of the so-called cancer of the lips and face, the product of highly developed sora. Okay, in 6th edition, Hahnemann have replaced it with product of highly developed sora, not infrequently in conjunction with syphilis. Underline this. Okay, so this is one instance where Hahnemann is saying that syphilis is causing cancer along with sora. Now go to 206. This is a case taking of chronic disease. 103 we have read, now 206.
Before commencing the treatment of chronic disease, it is necessary to make the most careful investigation as to whether the patient has had a venereal infection or an infection with condylomatous gonorrhea, for then the treatment must be directed towards this alone, when only the symptoms of syphilis or of the rarer condylomatous disease are present. But this disease is very seldom met with alone nowadays. If such infection have previously occurred, this must also be borne in mind in the treatment of those cases in which sora is present, because in them the latter is complicated with the former, as is always the case when the symptoms are not those of pure syphilis. For when the physician thinks he has a case of old venereal disease before him, he has always or almost always to treat a syphilitic affection accompanied mostly by complicated with
Underline
sora
this.
for the
Underline this. We have read tubercular diathesis of Robert is sora and syphilis. We have read though.
yes sir.
Sora and syphilis, and Hahnemann at many more than one point telling that syphilis often complicate with sora. It is also possible that sora is being complicated with psychosis, but most of the time syphilis, it is the syphilis which is complicating with sora, and that is another state, tubercular diathesis. Next. So these pure syphilis seldom you find nowadays. During Hahnemann's time, it was maybe possible that you are getting syphilis alone, but nowadays it will not. You will find always a mixed miasmatic disease, and how to proceed in that treatment, you have to treat the layer wise direction. The most predominant symptom will be treated first. Next.
For the internal itch dyscrasia, the sora is far the most frequent, most certain, fundamental cause of chronic diseases, either united complicated with syphilis or with psychosis. If the latter infections have outwardly occurred, at times both miasms may be complicated also with psychosis in chronically diseased organisms in the 6th edition.
Okay,
Or
yani three
as
miasms can be present. All three miasms, psora, syphilis, and psychosis, and we have seen that many diseases are there where the all three miasms are working together. Next.
or as is much more frequently the case, sora is the sole fundamental cause of all other chronic maladies, whatever names they may bear, which are, moreover, so often bungled, increased, and disfigured to a monstrous extent by allopathic unskillfulness.
Okay, that is the masked venereal disease. What was masked venereal disease? If you remember, please tell me.
Um, mercurial preparations were used for treatment of syphilis, which created
Yes.
a complex disease.
With what? With whom? Psora and syphilis was there. Sora and
Yes.
syphilis was there, and mercurial treatment come along. That was creating a mass venereal disease. Okay, so it is very often difficult to cure in these complicated cases if it is treated with heavy doses of allopathic medicines, repeated doses of allopathic medicine. Remember, mild allopathic medicines are not going to harm much but these repeated large doses of allopathic medicines will complicate with the natural chronic diseases. Okay, the masked steroid disease you will see, masked insulin disease you will see, masked penicillin disease you will see. Okay, not only the masked venereal disease. Here, now careful investigation. Second line, careful investigation. Go to footnote to that. That carries a footnote to it. Go to that footnote.
In investigations of this nature, we must not allow ourselves to be deceived by the assertions of the patient or their friends. Simply assign in the cause of chronic, even of the severe inveterate diseases, either a cold caught, a thorough wetting, drinking cold water after being heated many years ago, or a former fright, a sprain, a vexation, sometimes even a bewitchment, and etc. These causes are much too insignificant to develop a chronic disease in a healthy body to keep it up for years and to aggravate it year by year, as is the case with all chronic diseases from developed sora. Causes of a much more important character than these remembered noxious influences must lie at the root of the initiation and progress of a serious obstinate disease of long standing. The assigned causes could only rouse into activity the latent chronic miasm.
Underline this. Underline this. Whenever you are investigating a cause of your case, means a patient comes to you and told that I have a gangrene on my foot, and you ask that how it has happened, and he will tell that fallen from a I have fallen in an accident and that has caused me this gangrene. This accident or this injury can only arouse that miasm. Where is the cause? Cause actually lies in the body itself, and that is sura. By this whole footnote, Hahnemann is actually meaning that only. This is not that you will not consider that cause. That cause, what that cause actually have done, what that cause that have settled a series of event. Let me show you. We are using these causes for our prescription, aren't we? The patient coming to you after 10 years of a fright and told you that I have these kind of symptoms the moment I was frightened at that frightful night. Okay, don't you consider this cause for your prescription? Don't you think premium, aconite, opium for that? Yes, you will think. This is
Yes.
why Hahnemann is telling this, that that cause is not important, because of the root cause is there. You have to focus on the root cause. Okay, I have seen that one of in NIH IPD, one patient was admitted of nephritis, chronic glomerulus nephritis, and the patient was prescribed aconite by one of our teacher, aconite in LM potency. Okay, reason being the cause was getting wet in rain constantly after perspiring for 2-3 days. Few months ago or few years ago, the lady was a laborer, daily laborer, and while she was perspiring, she got wet in rain several times, and after that these symptoms developed. So wasn't the cause important here? Cause was important, but it actually have, so we are considering the cause. That should not mislead that Hahnemann is saying that that cause is not important. Cause is important. Why? How it is important for your prescription. Okay, you can prescribe aconite depending upon the causation which have initiated the series of event. Okay, but that cause is not maintaining the disease. This should be kept in mind. Okay, this should be kept in mind. Let me show you by an example. Okay, suppose this is a disease. Okay, disease in the man already. Okay, this disease can take 4-5 expressions. Okay, or suppose this 3 expression. Okay, disease is same. Okay, आटा का गोला एक ही है, उससे तुम पूड़ी भी बना सकते हो. Okay, उससे तुम समोसा भी बना सकते हो, उससे रोटी भी बना सकते हो. You can bake your bread break your samosa, break your luchi. Okay, you can bake anything you want. So disease is there depending upon how much force you are using. So depending upon the causation these are having. Okay, the causation these are having. Let me show. This causation will track this disease to this path. Okay, this causation, disease is same, but this causation is setting the disease on that path. Okay, this causation here will set the disease to this path. Okay, and this causation here is setting the disease to this path. Okay, so by this tracing this causation, you are actually able to locate your prescription. Okay, disease is same, causation have marked the track of disease. Causation is important in this sense. Okay, clear? So it is important in that sense. I hope it is clear why causation is important and why it is not. We should not be deceived by that just getting wet in rain all have started. This may, that is why the last sentence is important. That assigned cause could only rose into activity the latent chronic miasm. And this is one of the important part in the history you should take. Okay, and this is very much helpful in actual practice. Number 207.
When the above information has been gained, it still remains for the homeopathic physician to ascertain what kinds of allopathic treatment had up to that date been adopted for the chronic disease.
Underline this. Inquiry into treatment. We frequently get history of treatment. Okay, how it was treated. That was past history 206. Inquiring into how all have begun. Past history. Next, this is history of treatment.
What perturbing medicines had been chiefly and most frequently employed, also what mineral baths had been used and what effects these had produced. In order to understand in some measure the degeneration of the disease from its original state and where possible to correct in part these pernicious artificial operations or to enable him to avoid the employment of medicines that have already been improperly used.
Underline this in order to understand from that to original state. What mineral bath, underline what kind of allopathic treatment have been up to date, what perturbing medicines were taken, what mineral baths, underline all those. Okay, so in modern day practice, you cannot stop allopathic medicine all of a sudden. If the patient is taking an anticonvulsive medicine, you are not going to stop this all of a sudden. You have to, it will increase the case actually. Withdrawal symptom will be admixture with the artificial disease that have created plus the original disease which was there before. Okay, so you have to very cautious in withdrawing these allopathic medicines patient is taking for years. Okay, be aware of especially those anticonvulsive medicines. We homeopath have an itching to stop all the allopathic medicine at once, but that is not a scientific method. Okay, even if the patient is taking antacid, don't go and stop the antacid because it will cause much trouble and patient will abandon you. Okay, thinking that the Dr. Babu amar সব সমস্যাটা বাড়িয়ে দিয়েছেন. Okay, but he don't know that he have stopped the medicine. That is why the problem has been exaggerated. So don't stop all the medicine at once. We will, what procedure we will apply? We will slowly and gradually withdraw those medicines at the time when the patient is on our medicine. Okay, So what is the need to know these treatment, whether there was steroids, whether there was iron tablets, where there was tonics. Okay, each one will have a definite medicine in our Medica. If he is using iron tonics and tablets, then pulsatilla maybe you may think of. Okay, if he is using Ayurvedic or Unani medicine for long, you may think of Nux vomica. If he has been using penicillin or other antibiotics for long, you may think of Rustox. You will get rubrics in if he is using morphine or sedatives, antidepressant, you can think of opium, chamomilla, morphine habit. Okay, you will get rubrics in your synthesis repertory where particular drugs can be tackled with. If he is using steroids, you can tackle it with aldosterone. I hope I have covered this topic when we were dealing with artificial disease at some point of time. Okay, so the treatment, history of treatment is important in that sense. Okay, now 208 is a famous accessory circumstances. We have referred it to again and again. Last sentence, underline last sentence, whether that presents any obstacles to treatment or requires to be directed, encouraged or modified. Accessory circumstances. Okay, 209, go to 209 and read it.
The physician should endeavor in repeated conversations with the patient to trace the
Underline
outcome of his
repeated
disease as
conversation. Underline repeated conversation. This repeated conversation may be done in a single sitting, may be done in 2 or 3 sittings. Okay. ओके कल आइए, अभी हम आपको दवा नहीं देते हैं, कल आइए और टाइम लगेगा. ओके, दिस कैन बी अप्रोच, but it is not practical actually. This can be done with our close relatives, our close friends, but this is not practical in the clinic. Next.
with the patient to trace the picture of his disease as completely as possible according to the directions given above, in order to be able to elucidate the most striking and peculiar characteristic symptoms, in accordance with which he selects the first antisodic or other remedy having the greatest symptomatic resemblance for the commencement of the treatment, and so forth.
Okay, underline first antisoric or other remedy for the commencement of the treatment. Okay, you will need more than one medicine in very often. Not that one medicine will do a magic and no other medicine will be required. This is not the fact. Okay, go to aphorism number 182. 182.
Thus, the imperfect selection of the medicament, which was in this case almost inevitable owing to the too limited number of symptoms present, serves to complete the display of the symptoms of the disease, and in this way facilitates the discovery of a second, more accurately suitable homeopathic medicine.
Succession of antisoric medicine. I want to see you 171. Go to 171.
In non-venereal, those therefore that arise from sora, we often require, in order to effect a cure, to give several antisoric remedies in succession, every successive one being homeopathically chosen in consequence with the group of symptoms remaining after completion of the action of the previous remedy in the sixth edition. The expiry of the action of the previous remedy, which may have been employed in a single dose or in several successive doses.
Okay, underline this. Several antisoric remedies in succession. Several antisoric medicines in succession. Okay. So you will need several antisoric medicines for a case in succession. So only 104 remaining for this section, and then we will proceed to drug proving next day onward. Okay. Any question you are having, we will discuss. So thank you for giving your attention for 1 hour. We will meet today tomorrow, and we'll start from
Yes.
104. Okay.
Thank
Are
you,
you
sir.
telling something? Okay. Thank you.